You stopped the benzodiazepine. Within days, the anxiety came back worse than before you started the medication. So you decided the drug was the only thing holding you together. It wasn't. What came back was not just your anxiety. It was a counterweight your brain spent months building, still pushing against the pill that was gone. Now, this does not mean that you're weak, and what you're experiencing is not a character flaw. It's pharmacology. Your nervous system simply did what an adapted nervous system does. So by the end of this video, you'll understand three things: what that counterweight is, why your anxiety was worse in between doses, and why the last small step down is the hardest one when you attempt to taper. I'm Dr. Air, quadruple board certified psychiatrist. Benzodiazepines are a family of fast-acting anxiety and sleep medications. Xanax, Ativan, Klonopin, Valium, different names, different speeds, same family, same mechanism. Let's talk briefly about Brad, a 44-year-old teacher who had been on Xanax for 7 years. He told me he had proof he was broken. He had tried to stop twice. Both times, the anxiety came back so hard it frightened him. Both times, he said, my body made me feel it was impossible to stop this medication. But he had it backwards. That was not the truth about his anxiety. It was the truth about his pharmacology. You see, your brain has a brake. The chemical is called GABA. When GABA binds to its docking site on the GABA A receptor, brain cells, also called neurons, quiet down. A benzodiazepine does not add GABA. It presses harder on the brake you already have. Think about what a smart system does when something outside it holds the brake down. It stops maintaining its own. A researcher named David Greenblatt showed back in 1988 that with steady use, those docking sites become fewer and less responsive. Your brain turns down its own brake because something else is doing the work. Meanwhile, the accelerator, a chemical called glutamate, runs at full strength. Imagine working in a loud factory, machines running all day, every day for years. You do not decide to talk louder. It happens. Your voice finds the level it needs to be heard. And that becomes your normal when you're in there. That is what your brain did. The drug quieted everything down, so your brain turned itself up to keep working, not fighting the drug, adjusting to it. Then you stop the pill. The machines go quiet in a second. And you're still shouting. That is why stopping feels worse than never starting. You do not settle back to a normal voice. You're the loudest thing in the room. You're not back where you began. You're on the far side of it. One honest note. That receptor story is the leading explanation and has been for years. Newer research, however, says the changes reach beyond GABA and vary by brain region and drug. But here's where it gets interesting. Brad thought his trouble started the day he stopped the Xanax, but it started years earlier. Every drug has a half-life. That is how long it takes for half of it to leave your body. Some benzodiazepines are fast. They act fast and leave your body fast. Take one a few times a day and your levels do not sit flat. They spike and fall. And at the low point before the next dose, the counterweight gets a few hours alone. This has a name: Interdose Withdrawal. Symptoms appear between scheduled doses and settle when you take the next dose. So Brad was in withdrawal every afternoon for years, taking his medication exactly as prescribed. Now picture that from the outside. Anxiety worsening in the afternoons, a racing heart at 3 o'clock, waking at 4 in the morning before the bedtime dose clears. It looks like an anxiety disorder getting worse. It gets treated like one. Brad had years of describing an anxiety disorder that was spiraling. Some of what he described was a medication wearing off. And here's something else you need to know. In 1982, a doctor named Heather Ashton opened a clinic at the Royal Victoria Infirmary in Newcastle, England. It was meant for anyone harmed by any prescribed drug. Instead, she was flooded with people trying to get off benzodiazepines they had taken for years. She ran that clinic almost single-handedly for 12 years. When she started, the medical consensus was that those patients were exaggerating, not lying, exaggerating, overstating, being difficult. She studied the histories of more than 300 of them and found out they were not exaggerating their symptoms. They were genuinely struggling. This is why the answer is never just taking a pill. Benzodiazepines can hold that breakdown for you, but it cannot teach your nervous system to adjust. That relearning is a different work. It is what my program, the Nervous System Reset, is built around. The link is in the description. Now, this next piece changes everything. Brad's second attempt to stop Xanax came apart at the very end. He had come down a long way, but the more his dose was decreased, the more he struggled. And there's a reason for this. How much drug is in your body and how much of the receptor it covers do not move in a straight line. They move on a curve. At the top of that curve, taking away a chunk of the benzodiazepine does not change much. At the bottom, taking away a sliver changes a great deal. Picture a dimmer switch almost all the way down. The last bit is where the room goes dark. So the final step, the one everyone assumes is easy, is often the biggest jump your brain feels. Brad did not fail at the easy part. He hit the steepest part of the curve and felt the effects. His anxiety was through the roof. This is not uncommon. In 2025, 10 medical organizations, including the American Psychiatric Association, published a joint tapering guideline funded by the FDA. It says coming off can take months to years. 10 mainstream societies, months to years. Anyone who told you 2 weeks was working from a guideline that no longer supports it. There is one more piece to this, and it is the most important one. Nearly 24 million people in this country are prescribed the benzodiazepine, and we still cannot tell you how many of them will have a hard time coming off. In 2025, a review gathered 46 studies of people a month or more past their last dose. In 61% of those studies, there were withdrawal symptoms even past the acute phase. For some, that continues for months, sometimes years. But this is what was striking about the summary of that review. There was no way the researchers could tell how many and who exactly will struggle with the withdrawals from tapering of benzodiazepines. So nobody has found what separates the person who sails through from the one who does not. Acute withdrawal from benzodiazepines presents in a certain way. Dr. Ashton called it a mirror image. Every symptom is the exact opposite of what the drug was doing for you. The pill gave you sleep. Withdrawal gives you insomnia and nightmares. The pill loosened your muscles. Withdrawal gives you tension and spasm. The pill gave you calm. Withdrawal gives you panic. The pill held seizures back. Withdrawal can cause seizures. One thing to always remember, never stop a benzodiazepine abruptly on your own. Abrupt stops can cause seizures. Always discuss with your doctor. And there is a trap here that catches people off guard, especially on Klonopin. Klonopin has a long half-life, around 30 to 40 hours. It leaves the body slowly. So when someone stops it cold, day one can feel almost fine, day two still fine. But with Klonopin, withdrawal often does not show up for 1 to 4 days. The drug is still in there, quietly being eliminated from your body. The slow clearance delays the danger. It does not remove it. Withdrawal seizures can still happen. The next video sheds more light on this.